Hey everyone, I'm almost there. Give me 1 minute. Okay, hey everyone. Welcome to today's webinar. It's on ADHD. Let me pull up my presentation here. Okay, here we are. Hi everyone, happy Wednesday. It's a little gloomy here in Santa Barbara today, so hopefully we can lighten things up with learning about ADHD. Specifically for your child, however, I've already had questions, is it only for children? At the end of the day, the etiology or the root cause of ADHD and then how we can identify or fix it, heal it, treat it. It's really the same for both adults and children. It's just that I'm focusing on children because that's what we see it more often in children. So that's kind of what I'm going with, but know that if you or your friend has ADHD or ADD, that this can still be applied to you. So let's get started. So the main points, first of all, talking about what is it? What is ADHD? Why might my child have ADHD? What causes it? And what can I do about it? And how do nutrition and toxins affect my child's health? Really, from all angles of your child's health, the things that they put into their body, whether knowingly with food or unknowingly with environmental toxins, it does affect the growth and development and behavior of your child. And can I help change my child's diet and lifestyles to support their growth and development? The answer is yes, and we're going to go into how. So let's get started. All right, so why do I care about kids' health? I am the pediatric specialist here at Regenerate Health Medical Center. Pediatrics and family health and wellness is kind of my thing. Among other things, I do mood, behavior, I do hormones, gut, skin, so plethora of things, but I do love children's health, and it's because the growth and development of your child is so necessary. It's so important to address it naturally. I'm not going to get into vaccines or anything today, but in terms of conventional care, it's very focused on the one thing, right? So we need to look at your child's health, growth, development in a full 360 view of their being, from the time that they're born to now. And so it's really important that we help rebalance their body. And we can do that really simply, especially for children, because they're so resilient. It doesn't take a lot to rebalance their body. It's just that we need to find the right things to do so. When their body, anyone's body is not treated properly, can lead to a lot of other concerns as they grow, develop, and then into adulthood. That can be fatigue, pain, insomnia, chronic gut issues, which then lead to, mood and behavior disorders. It leads to, skin rashes, chronic digestive problems, etc. Then they can also have irritability, sensitive as they grow up. Maybe they're not picky eating, but as they grow older, they can't eat a lot of different foods because they seem to be intolerant to them. So there's a whole lot that goes into it. And so we want to address things right from the get-go and rebalance them from the start. So here are some statistics on ADHD specifically. So 9.5% prevalence for children between ages 4 and 17. Now these are a little bit old in terms of the statistics, but it's still interesting to note. So the older children get, 15 to 17, the more people are diagnosed with ADHD. And it is a true diagnosis. However, I do find that children coming to me, sometimes they don't have ADHD and they have been diagnosed with it or they've been on medication for it. When really the true issue is maybe a gut infection or imbalance of neurotransmitters. They just need to detox a little bit. Maybe they just need a little bit more support in the classroom. So sometimes It can be a quick diagnosis. And so it's important, to look again at the whole body to understand what really is going on. Is it true ADHD or is it something else? 4.8% of children are being treated with medication. A lot of these kids tend to end up having a flat affect, meaning they really don't have a lot of emotion. They're kind of flat is what we call them, or people say that about their mood and emotions. They don't have a lot of motivation, not a lot of drive, not a lot of energy. Sometimes that is the truth for these kids on medication. So if we can, do something other than medication, they'll be able to still live their childhood, and be happy, excited, have change of emotions, etc. So what is ADHD? Attention Deficit Hyperactivity Disorder. It is characterized into three different types. There's combined type, predominantly inattentive, predominantly hyperactive / impulsive. So the combined type is that you have 6 or more symptoms of each category, meaning 6 or more symptoms of inattention and hyperactivity, inattention, and then also of hyperactivity and impulsivity. This is the most common type. I didn't go into the symptoms, you guys, because I just decided not to, but they're all listed online and you can just type it in and it'll give you, it was just a lot. There's a lot of symptoms and I just didn't really have the space to list them all out. So just to let you know, you can look these up really easily. It's a long list. But anyway, so combined type accounts for 50 to 75% of cases. Next most common is predominantly inattentive. So that means 6 or more symptoms of inattentive symptoms, identified, but fewer than 6 hyperactivity or impulsivity symptoms. And that's 20 to 30% of cases. And then the least common is the predominantly hyperactive impulsive. And that's 6+ symptoms of hyperactivity, impulsivity, and fewer than 6 inattentive. Again, that's 15% of cases. So again, sorry I didn't have all the symptoms listed out there. Again, there's a lot of them. So, but looking at, most commonly there's a mixture of inattentive and hyperactive impulsive. So if you think of, the child in class that, doesn't pay attention, but then is really impulsive and might say something out loud, or, gets up from their seat and just walks around the classroom or something, that seems a little bit bizarre, that's the combined type usually. So as an example, and that is the most common. What we find is that there are structural and chemical changes in both parietal, temporal, and prefrontal cortices. So you can see that little brain picture there, that there are, on brain scans, there are changes in the brain itself. And those are things that we can address and try to treat naturally. Of course, depending on, what type of structural changes, because I can't go in there and remold the brain, but there's a lot of herbs that can support, herbs and homeopathy that can support the restructure and rebalance of those chemicals in the brain. So here, I was kind of talking about some of the brain scans. This is a drawing, but looking at a healthy brain on one side and then a brain with ADHD on the other. So generally it's a smaller brain. It doesn't look as fully developed, especially in the frontal cortex, which is, the decision-making part of the brain. So you can just see there how it looks a little bit different. So why might my child suffer from ADHD? So the things listed can all be causes, and it can be a combination of a few, it can be just one. All of these cause changes in the neurotransmitters in the brain, which are sort of our brain chemicals. You guys have heard of dopamine, serotonin, epinephrine, those types of things. Those are all neurotransmitters. And most often the neurotransmitters that are affected are dopamine and noradrenaline. So with these, I'm going to go with a few examples of some of these. So environmental toxins, heavy metals. So heavy metals we can get from our food source, we can get from our water, we can get from vaccines. Other things are, paint, gasoline. Well, maybe not gasoline as much. That is a toxin, but it's not a heavy metal. Sorry about that. But paint for sure. So when we get these environmental toxins in the body and we're not able to properly detoxify them, they build up. And what the body does is it sequesters these heavy metals in the fat cells, because we know that the fat cells are stable, right? They can hold on to things, and that allows the body to take it out of the bloodstream so that these heavy metals aren't just circulating throughout the body. So it's a protective mechanism to go into the fat cells. And these heavy metals and other toxins can build up in the fat. So that's why it can be really difficult to detox from heavy metals, is because we have to allow them to get out of the fat cells, and then not only out of the fat cells, but then out of the body completely, right? So we have to make sure that our forms of elimination are open. So that's, stool, urine, blood, breath, sweat, are all really big ways of detoxifying or getting those heavy metals out. But that can cause ADHD. Maternal habits while pregnant, maybe mother of the child smoked or used alcohol. There can be toxins in food additives, which then impair the gut. And then when the gut is impaired, there is leaky gut. And instead of having all good bacteria in the gut, there is an overgrowth of bacteria. A lot of times we find a bacteria called Clostridia that is very commonly overgrown in kids, especially. And that's where we find a lot of ADHD symptoms. Other illnesses, that sometimes, kids get sick, and it seems like they were never, since that illness, they never really got better. And that can be confounding things, whether it be a medication or some type of other imbalance. Hormones can cause it, especially in adults. We have a really nice interplay between reproductive hormones, thyroid hormones, adrenal hormones, all these things. And if one of them is off, they're all sort of off. So let's just say, for example, with men, testosterone's off, right? And then they have higher estrogen, lower testosterone. Well, that's going to really change their mood a lot and might show some symptoms of ADHD, for example. And then genetics is pretty self-explanatory. So those are some causes of ADHD. I just wanted to put this in here because I talked about neurotransmitters a few different times. Sorry, that's serotonin. I'm going to move that down. And like I said, noradrenaline and dopamine are the two most common that are imbalanced in ADHD. So noradrenaline helps kids concentrate. Well, that makes sense. If that's low, they can't concentrate. And then dopamine is the pleasure. So, things that make you happy. Those two can often be off, but if those are off, generally they're all a little bit off. So I tend to take a look at all of them and allow, support the body in rebalancing those naturally. Of course, then there's always the notion of, okay, well, they are imbalanced and we can help fix them, but why was it imbalanced in the first place? Because if we don't remove the cause that is making these imbalances in the first place, we're never really going to get anywhere. So it's important to look at all of those aspects to really treat the root cause, which is what I do as a naturopathic medical doctor. Okay, so some specific concerns. I did mention the gut very briefly prior, but that is really the number one thing that I look at for really all of my patients, because generally if the gut is impaired, there's going to be a lot of other symptoms involved. And I talk about leaky gut in almost all of my webinars. We're all born with a leaky gut. So when mom gives birth, baby has a leaky gut. And that's why there are, doctors talk about, the importance of, a vaginal birth and then of breastfeeding, because those two things help the gut in your baby to heal. The reason for the vaginal birth is because there's a lot of healthy bacteria and immune markers and regulators that baby gets when gone through the vagina. If C-section, it doesn't get all of those beneficial bacteria and microflora, and it, usually there's more trauma involved just because of this more surgical aspect of it, and sometimes more medications are involved for mom as well. So that's the difference there, but that doesn't mean that everything's lost. So if C-section was to occur, the most important thing then is to breastfeed. Some moms have difficulty with not only making milk, but letdown of milk. And that is something that I also help moms with. But breastfeeding, I usually recommend at least 6 months. That's the very, very bare minimum. But I like to recommend up to a year of breastfeeding, and that immediately allows the baby's gut to heal. So we must repair the gut. We must. And even if those two things went great, baby was born vaginally and was breastfed a year, sometimes kids still have leaky gut. Maybe they got sick when they were a baby and they had to go on antibiotics. That's going to completely impair the gut lining and mess up the microbiome. Other things is maybe, there was something that mom was eating that baby was a little bit intolerant to, so it was transferred through the breast milk. That can cause leaky gut. One other example, well, vaccines are another example, but one other example is any type of trauma that the baby had. Maybe not even on purpose, but it was a traumatic event for baby. Those things can cause leaky gut. So it's important to treat the gut, and generally, because the gut and the brain are so highly connected, if I can heal the gut, I find a lot of improvement in brain health and mood. So that's anywhere from depression, anxiety, sometimes OCD, like I said, ADHD, impulsivity, all those things. If I can heal the gut, the brain tends to heal as well. And I'm going to skip over liver for right this second, and I'm going to go to brain. I already talked about neurotransmitters, so I'm just putting that there again. We need to rebalance those neurotransmitters. Excuse me, but the brain can also have inflammation. Inflammation, for various different reasons. Some of these reasons I already talked about with the gut, but toxins in the home or the environment can cause brain inflammation. Any concussion, inflammation, and sometimes it's not just during that time of repair, but it lasts a long time. Eating unhealthy foods causes brain inflammation. So, I'm looking at both of those aspects and treating the gut, but then also decreasing the inflammation in the brain to allow, more blood flow, lymph flow, and the neurotransmitters to regenerate in the brain. Because the brain is really what talks to the rest of the body, right? So I can move my hand because my brain tells my hand to do it. So if there's too much inflammation or hormones aren't talking properly, I won't be able to have the regular bodily functions that I would like to. So, and then the liver. So the liver is the major detox organ. Our body detoxes every single day, all day long. And the liver is the major organ that does that. So the liver metabolizes all drugs, hormones, environmental toxins, all of those things. So let's say we're eating fish and there's a lot of mercury in the fish. Well, the body's going to be like, okay, I'm going to detox as much as possible because that's not something that I want in the body. And it's going to do that as much as possible. But if it can't keep up, or if it is congested or not properly working, there's going to be a buildup of those heavy metals. Or, for hormones, if the body can't keep up and the liver is congested, it's going to have a buildup of hormones, for example. So if the liver isn't properly working, the body can't properly detox, and thus we have toxins in our body and our brain, and it can cause mood changes, specifically like ADHD. So, looking at all of these things, it's really, really important to repair the gut, keep the brain and the liver and the gut detoxified and moving, and to make sure that your child is having a healthy diet. That's really, that's the one thing that you have a lot of control over is the diet. So, making sure that they're not, not having junky processed foods with a lot of sugar, a lot of fat, a lot of gluten, all those things. Identifying if they have any food intolerances. Most often food intolerances come from a leaky gut, which we can fix, but identifying if there are food intolerances, because that inflammation that food intolerances cause for kids can cause mood and behavior disorders. So keeping those out of the way. Noticing if there's any heavy metal exposure, right? So like I said before, vaccines, paint, fish, those are gonna be higher in heavy metals. If there are nutrient deficiencies, so maybe your kid just likes pasta. I just want butter noodles, mom, just butter noodles. That's tricky because if let's say they have that for breakfast, lunch, and dinner, and maybe a glass of milk a day, well, that's going to have a lot of nutrient deficiencies, right? So the body is not getting what it needs from the diet. So, metabolic processes in the body aren't going to work. The brain doesn't get all the nutrients it needs, so things are going to start to malfunction in a way. And then hormones, like I said. So there's a ton of different hormones. It's not just reproductive hormones. But, making sure that if you're noticing things are kind of different with your child, well, we might need to look into hormones. So those are all things that, I look at as the doctor, but you notice that my kid's acting a little funny, or they're not paying attention as well, or, they seem to always, have a stomach ache, something like that. There is a plethora of reasons why. So just noticing that in your child and not waiting, because we can avoid these mood and behavior disorders, or like I said, fix them if we can address the root cause. Okay, so how does nutrition affect my child's total health? I kind of already mentioned this. Is diet alone enough to change my child's health? Yes, it can be. And that means that if things aren't progressed so much that we don't need intervention with supplements, or homeopathy, for example, but the diet is very powerful, especially in kids, especially because their bodies respond so fast, right? So making sure that you're having your child eat high quality proteins, that could be meat or vegetarian proteins, but high quality, organic, non-GMO, non-additive, no antibiotics, etc. Lots of vegetables, a colorful diet that could be fruits and vegetables actually, and then grains, sweet potatoes, quinoa, brown rice, even jasmine rice, making sure that they're getting a whole lot of different foods can really, really change their health and support their growth and development. Again, if the brain isn't getting enough nutrients that it needs and enough fats, they're not going to grow or develop as well as someone who is. So that's really important. And then when to consider supplements, to avoid or decrease the deficiencies. Again, if your child is really picky and they're the butter noodle kid, that might be time that we need to look into supplements, or maybe your child was not born vaginally and you weren't able to make a lot of milk. That might, we might need to look into supplements there too. So they can be very, very helpful for kids, especially when there's mood and behavior disorders involved. Some supplements to consider would be like anti-inflammatory fatty acids. Magnesium is good for, and I'm not saying dosages because I don't, want to give medical advice over this webinar, but I'm just mentioning a few that I look into. So magnesium can be good for, inattentive, but also impulsive ADHD. Probiotics, like I said, for the gut health. Sometimes we need specific vitamins, B vitamins, antioxidants to support the detox processes, and homeopathy. I really, really enjoy using homeopathy with kids. It's very easy for them to take. It's very gentle. And because, like I keep saying, they're so resilient, it works really, really well for them. And it's, like I said, it's pretty well complied with because it's so easy. And, usually it's little drops or little pellets, and they just go throughout their day. So, they don't have to swallow these big pills that you see on the bottom of the screen here. That might be more for an adult. But I do, especially for kids, when swallowing pills are hard, I use chewables, but I also like to use liquids and powders. So just as a little thing there. And let's see. Okay, so yes, medications are not the answer, whether that be for ADHD, whether that be antibiotics for, sometimes antibiotics are very, very, very useful and important, but it does, impair the gut lining for the child. And then another one that I find that causes leaky gut for kids is proton pump inhibitors. Like when babies have reflux. The only reason why babies have reflux is because they're either eating too much at one time, they have a food intolerance, or their digestive system is not completely developed. We need time to do that. So anyway, that was a little bit off topic, but medications are not the answer, and you have other options. Remember, always treat the cause. Always treat the cause. So instead of giving a Band-Aid of an ADHD medication, it might be beneficial to look into some of the other causes that we talked about. Food intolerances, inflammation, metabolism, toxins, you name it. All those things. Okay. So here we're getting near the end. Here are some naturopathic treatments. So this is going to be a little bit repetitive here, but treat the root cause of the imbalance. Treat the root cause of the imbalance. Otherwise, there will be no resolution. Okay. So I use patient symptoms, patient history, and then lab work to identify those root causes. Lab work generally, especially for kids, I can do a stool sample, a urine sample, or saliva. So I can bypass blood for most things. So it's really, really important for me to use those to identify the root causes. And then immediately dietary changes. So let's take out some inflammatory foods, foods that might be causing stomach upset or brain inflammation. The top two that I find that contribute to inflammation is gluten and dairy. So, and sometimes it doesn't need to be for forever, but taking those out until we can resolve the issue. Other ones, eggs can cause issues, peanuts, shrimp, the basics, but dietary changes and making sure that we're getting a lot of fruits, vegetables, a well-balanced diet for the child. Low sugar, not a lot of pizza that's processed, not hot dogs that's processed, things like that. And then lifestyle changes. So do we need to look at the child's sleep? Are they not sleeping well? Are they able to move? Exercise meaning, do they play? Are they getting movement? That really increases neurotransmitters for both kids and adults. It also helps to detoxify. So there's so many benefits for exercise. I could go on, but you guys understand what I mean. And then stress relief, there's some kids do have more anxiety or more stressors than another child, and that can lead to mood and behavior disorders as well. So identifying those stressors for the child. So all of those things can sometimes make a big difference. And then if needed, we go to natural supplementation. So like I said, herbs, vitamins, minerals, homeopathy, all of those can help support and rebalance the child's body. And then there's also some in-office tools and treatments that we can use most often for adults, but there are, I do offer some anxiety relieving treatments. If the child is old enough that we can do IV therapy, sometimes that's helpful as well. So there's a lot of options there. So again, this is a little bit repetitive, but I wanted to look at a little bit more specific things. So, implementing mindfulness can be really helpful for kids. maybe that's meditation and starting them early. Maybe that's some kid yoga. Maybe that's just noticing, how does my body feel today? And they can tell you. Kids are smart. And we're seeing that more and more. Sometimes we think, oh, kids don't know. They know. They're very, very intuitive. And so implementing mindfulness can be really helpful. Addressing their emotional health and mood, of course, with ADHD, that's very important. So checking in with your child, seeing how they're doing, how they're feeling, what's going on at school, what about how is your brother or sister treating you, etc. Supporting healthy movement habits. So especially right now with quarantine, it's kind of up, but things are still funky. Getting outside, playing, going on a bike ride with the family. Let's go on a walk. I don't know if pools are open yet, but swimming, all the movements that bring the child some of those, healthy neurotransmitters that can make them feel good, and they can decide the things that they like to do. And that also helps for stress relief for kids. Addressing proper sleep patterns. So some parents go to bed really late and they allow their kids to be up really late. Kids need a lot of sleep, and the best is earlier. So the earlier they go to bed, the better quality sleep they get. If there's insomnia involved, if there's nightmares involved, that's sort of another root cause that I can help with. But addressing those things that, sleep time is sleep time. We need to go to bed and wake up around the same time. Now, their bodies will let them know. But, if there are problems with sleep, that's going to cause other problems and imbalances. So if that is needed to be supported, let me know. Of course, supporting detox pathways. We talked about that a little bit. Supplements we talked about. Those should be monitored by a doctor for safety and efficacy. It's a big market out there now on Amazon, GNC, Whole Foods. You can just go pick up anything you want. And I just want to say, be careful with that. Sometimes it can make things worse. Sometimes the quality is not good. You're not really addressing the cause. There's a whole lot of things with that. So just be mindful of that and careful with supplementation on your own. I really would recommend using a doctor. And then addressing other confounding factors. So for example, maybe the kid gets a lot of ear infections, right? And then they're taking a lot of antibiotics, and then it's affecting their gut health and their mood. Well, we need to address the ear infections, as well as the gut health and mood. So addressing the other conditions that the child is dealing with. Again, I look, complete 360 for your child, putting all the puzzle pieces together so that they can live really their healthiest and happiest life, growing up healthy and, being supported and balanced that way. Just looking if I have any other, the other thing I didn't mention for diet. So I mentioned food intolerances like gluten and dairy free. I also mentioned good quality meats. So I said non-GMO organic. So just wanted to reiterate that. And then I only briefly went over this, but additives, especially colorings, can make ADHD a lot worse for kids. Specifically, there's a yellow coloring that can really, really affect kids' moods. There are other kids that are actually allergic to, red dyes, things like that. So please look at the back of your child's food, what they're eating, and please try to stay away from any additives, any food dyes, anything like that. It's so foreign to our body. It wreaks havoc. So try to stay away from those processed foods as much as possible. All right, and then what can you do now? So we did talk about some of this stuff. Making sure that, again, the one thing you do have control over is their diet. So supporting them with a healthy diet, well-rounded diet, making sure they're getting enough fat, protein, and carbohydrates. Support their sleep, manage that, make sure that they're getting enough sleep, they're getting to bed on time, they feel safe, they feel energized in the morning. And then supporting your child's ability to heal. So maintaining hydration, encourage movement and playing, again, check in with them. How are they feeling? how's their body feel today? How's their mind feel today? And then again, using, herbs and nutrients to support as needed. But I wanted to include things in this webinar that you as the parent could begin right away, to help, calm some of their moodiness or impulsivity or flat affects, because there are a lot of things that you can do to support them. And then when you've done those things and you still need some support, I am here for you. Or if you don't know where to start, I'm here for you. Or if there's a lot of other confounding factors, and you just want to streamline everything and not try too many things, because that can be hard on the child too, I'm here for that. I do see a lot of kids with ADHD and autism, and there are so many things that we can do for them. There's so many ways to support them. And I've seen such wonderful changes with kids. So I just encourage you to know that there are a lot of options, and you don't have to decide on medications for the long run, or to suffer with them for the long run. So because I know it's a lot of stress on the parents, not only the kids. So here for you guys as well. So that's kind of what I was saying, is your child does not need to suffer. ADHD and other behavior disorders don't have to be scary, because you have a lot of support and resources. It's just finding the right person to do that with, or books or blogs or webinars. So just know that there's a lot of support out there, and there's a lot of improvement that we can make using all natural rebalancing practices. So your child is very powerful. They are so intuitive. They have a lot of good in there. So they have a lot to contribute to the world as well. So what do you want to create for your life and for their life? Thinking about that and how you want to move forward and be the role model for your child. So with that, I do offer free 15-minute discovery calls if you would like to chat a little bit more specifically about you or your child, your case, and see if we would be a good fit for each other. If you have specific questions, absolutely, I can chat with you over the phone. So that's one thing. One realm you might be in. The other one is, that was awesome, and I am ready to make an appointment. I don't know where to start, but that sounds like it would be a really good fit. Absolutely, we can chat, or we can get you on the schedule as soon as possible. 805-620-7122. That'll be on the next slide as well. And then the other realm that you might be in is like, that was great. I got all the information I needed. I know where I'm going to start. I'm going to do a few things with my child and see if that helps. Awesome. I'm glad to be that support and resource for you. I'm, always available to be a resource for you. So you're likely in one of those three pathways on those roads. So again, if you would like to have a discovery consult with me, go ahead and give us a call. We can get you on the schedule to go over your personal questions. If you're ready to book, you want to get things going right away, also give us a call and we can get you on the schedule. So I hope that was helpful for you guys and give you a little bit more understanding of sort of the underlying causes and things that you can do to support your child with ADHD. If you guys need anything, I am here for you. And other than that, I hope you have a wonderful rest of your day. Thank you guys so much.